Ready? Yeah, ready. Okay. Good afternoon. This is Joe McComb, Mayor of the City of Corpus Christi. We'll start our 5 o'clock briefing a few minutes late. We apologize for that, but we had a little excitement today during the City Council meeting. Our alarm went off, so we weren't sure what we had, but found out it was a water pipe and not a fire. So we were very fortunate for that and grateful for that. So today has been a good day in the city. We had a meeting today, the county judge and myself and Mr. Zanoni and Billy Delgado and several other elected officials had an opportunity to have a face-to-face with Governor Abbott. He came to town demonstrating his commitment to the people of South Texas and the coastal bend, and it was a great a visit. We got to share with him what we were doing with our COVID-19 and also give him some assessments and issues with our storm. And he is very sensitive to that and understands what we're dealing with, and just wanted to reassure us in person that the state is there to give us what support they can. We were able to share with him some of our concerns in dealing with COVID. I think based on the last week or so's numbers, and Peter will give you the new numbers today. I don't have them. I just walked in the room. But I think we may have plateaued. I don't know. I hope so. I'd rather see it on a steep downhill curve, but I think we've at least plateaued, and so that's something, and I want to thank the citizens for that. And he'll also be able to address some of the issues about the staff is out doing some assessment now on storm damage. And again, we're grateful for that. And I did hear the judge express her concern about the baa period of the governor. And that's something that all of us have used in our lives at some time or another. It's a fun place to be. It's a kind of an iconic symbol of our community. And we're going to wish them well in getting that restored as quickly as possible. And the good news is that no one was hurt or killed in the hurricane. So overall, it's been a good day. And for those that are wanting their brush and trash picked up, work with us a little bit. Put what you can into your trash cans on your regular day. If it's big, bulky stuff and you don't have a car or a pickup truck or a trailer, we'll get it picked up. It's not going to be in the next day or two probably, but our normal brush, the manager may go into that. They've got they've got a schedule and a plan of attack. He'll give you the details of that. But we'll get our city back up and running and clean as possible, as quickly as possible. And we just appreciate everyone's support and encouragement. But continue to work with us on the COVID. Continue to wear your face masks, even when you don't like to. I don't like to wear them. Probably majority of folks don't like to wear them. But I like to have my friends healthy and my family healthy, and so it's worth it to me to wear it. So I'd encourage you to continue to do that. And I'd like to ask Mr. Zanoni to come up and give us a briefing on where we are COVID-wise, as well as what information he may have on the assessment of the damage that's sustained in the city. And then following him, Ned Rodriguez and the judge will come and share with us information they'd like to share with you. So it's been a good day. Blue skies and puffy white clouds, so that's always a good day. Mr. Zanoni.
El día de hoy tuvimos una junta con el gobernador del estado. Pudimos discutir el huracán Hanna y nos quiso asegurar que tenemos el apoyo del estado para ayuda con Hanna y el COVID. Esperamos haber ya podido aplanar la curva en nuestra área. Su equipo estuvo evaluando los daños ocasionados por el huracán Hanna. Las buenas noticias es que no se reportaron fatalidades. Continuamos trabajando para recolectar ramas en toda la ciudad y le pedimos paciencia. Trabajamos lo más rápido posible. También le sigo pidiendo que continúe utilizando su cubrebocas para poder mantener segura a su familia. Ahora va a hablar el administrador de la ciudad, Peter Zanoni.
All right, good afternoon, everybody. I'm Peter Zanoni, City Manager of the City of Corpus Christi. And I'm going to give you an update on the COVID-19 statistics for the day, talk about hospitalizations and number of deaths as well. So let's begin with the number of new cases for the day. And as this graph shows, there's 254 new confirmed COVID-19 cases for Nueces County, which is still too high, way too high. And compared to yesterday's 230 additional new cases, that's 24 more compared to yesterday in terms of total number. So 254 for the day. We talked to the governor today, and I told him that we need to get back to the days when we were reporting zeros and threes and ones and zeros and zeros. So these numbers are still atrociously high, and we need to work as a community to get them back down to zero is the goal. Okay, when we look at the number of active cases compared to recovered, we're doing better in that area. The more persons are recovering as time goes by. We know we had a big spike in the last couple of weeks, and so those persons are beginning to recover more, and more of them are recovering. So 34% of all the cases are in a recovery category, but 66% of persons are still in the active phase of the virus. And as the chart shows, there's 154 deaths in Nueces County. There was an increase today of 5, I believe. Let me just double check here. Of 6, I'm sorry. And we'll show you that in a moment in a different graph. The number of hospitalized patients has decreased since yesterday. There were 414 in the hospital as of yesterday, and 13 persons have been released from the hospital. And so 401 is the total number as of this afternoon of persons in the hospital. And of that amount, of the 401, 152 are in ICU, meaning they need more extensive help in their recovery phase. And those 152, or that number of 152 is the same for the past 2 days. And it doesn't mean the same exact people are in ICU, but there's 152 persons in ICU, and that has remained level. And then the number of deaths, I mentioned we had 6 additional deaths today. One of the deaths was a doctor who spent his lifetime treating patients in our community. And part of one of the doctor networks, Dr. Papanini sent me a personal note today giving me information about the death. And we're sorry for any death, but especially somebody like this doctor that spent a lifetime helping people out, and he died from COVID-19. So a total of 6 additional deaths today. Yesterday we had 148 reported, so today's new total is 154. And then when we look at the final graph here, it shows the number of daily new cases, but it shows it over time, and we have a 7-day average trend line. And that line's kind of somewhat stabilizing, and we need it to go down. It's kind of plateaued out or leveled out, but yesterday it looked like it was going back up, and so we need to make some headway in decreasing the number of cases below even 200 to start. So the 7-day average is 257 new cases every day. That's the 7-day average based on that 7-day trend. Okay, so that concludes the statistics. Just to take a minute on the hurricane recovery, that seems like it's been a long time ago, but it was just a few days ago that it left. And the city has made a lot of progress beginning Sunday. In fact, the storm clouds were still in the sky. We had over 300 city staff members on a Sunday. We called in to begin the cleanup across the entire community from the island all the way here to North Beach. And so tremendous amount of improvement has been done in the right-of-ways, getting debris picked up and taken away. On the island, we're beginning to make access to the beaches. There's a significant amount of sand that has been deposited on the area that we normally drive on, and all that has to be removed because when it dries out, it'll be too soft for vehicles to travel through. And so the staff is in the process, the City Parks Department is in the process of removing the sand to get back to the more compacted layer that exists there. You may notice from some of the pictures, a lot of the dune, I think about 20 feet of dune from the dune line toward the ocean was eroded. And what that has done is actually opened up our beaches a little bit more. But a lot of that sand has been displaced onto the beach, and so we need to remove that so people can drive eventually back on the beach. We want to thank the Padre Island Neighbors, a big volunteer corps from Padre Island Neighborhood Group, PINS is what it's known as, led by Alex Karras. We're out first thing this morning. Actually, they had two groups of people. One just by the White Cap area, by the Wynwood parking lot, and then one went to the Bob Hall area as well. And they picked up numerous bags of garbage, meticulously getting that along the beach line, coastline. So we want to thank those volunteers for helping out the city and helping out their community. As we move through the downtown area, a lot of cleanup is taking place at our downtown marina. North Beach is being restored, and we're working with the GLO on how to re-nourish that beach. But all the roads that had a tremendous amount of sand and some of the public plazas by the Lexington and the aquarium have been cleared now. They were cleared as of yesterday. And so those are just some of the areas. There's a lot more happening in the community. We have 10 teams of staff out there taking note of the damages and cataloging it and analyzing it and recording it, and that'll help us with recovery dollars from the federal government, also help us in our work plan to restore things that were impacted by Hurricane Hannah. Okay, so that's just a quick recap. We're going to have Gabby translate into Spanish, and then we're going to have Annette Rodriguez come up and talk to us about some of our health matters. Thank you.
En las últimas 24 horas se reportaron 254 casos confirmados por el coronavirus, haciendo un total de 10.901 casos. 3.674 pacientes se han recuperado por completo, 401 se encuentran en el hospital, 152 están en la unidad de cuidados intensivos. 7.073 casos aún están activos. El día de hoy se reportan 6 fallecimientos. A la fecha, los fallecimientos totalizan 154 personas. Desafortunadamente, uno de esos fallecimientos se trata de un doctor, aunque cabe recalcar que todas las muertes son lamentables. La ciudad ha hecho buen progreso en cuanto a la recuperación por el huracán Hannah, especialmente recolectando escombros, y estamos intentando también abrir los accesos a la playa, pero aún falta más trabajo, sobre todo por la arena que se encuentra suelta y las dunas se erosionaron. Le queremos agradecer al grupo PIN o Padre Island Neighbors que nos han ayudado en el área de la isla y de la playa. Asimismo, en el área de la marina en North Beach continúa la limpieza.
Annette Rodriguez, Public Health Director. The Health District wants to extend their condolences to the families of our 6 COVID-19 related deaths today. The continual loss of lives is very concerning and heartbreaking to us all. In an effort to keep the community informed, I want to share with you a media release issued yesterday by the Texas Department of State Health Services on how they have improved the state's reporting of COVID-19 fatalities. The Texas Department of State Health Service is improving the reporting of fatalities due to COVID-19 by identifying them through the cause of death listed on death certificates. This method allows fatalities to be counted faster with more comprehensive demographic data. Using death certificates also ensures consistent reporting across the state and enables the Department of State Health Service to display fatalities by date of death, providing the public with more information about when deaths occurred. The change was reflected yesterday, July 27, 2020, and it was posted online. A fatality is counted as due to COVID-19 when the medical certifier, usually a doctor, with direct knowledge of this patient determines COVID-19 directly caused the death. This method does not include deaths of people who had COVID-19 but died of an unrelated cause. Death certificates are required by law to be filed within 10 days. Department of State Health Services previously counted COVID-19 fatalities as they were reported publicly by local and regional health departments after they received a notification and verified the death. The length of time that process takes varies by jurisdiction and does not provide timely demographic information on most fatalities. As of yesterday, July 27, 2020, death certificate data identified 5,713 fatalities among Texas residents, including 44 newly reported cases. That compares with 5,038 deaths that were reported Sunday under the previous methodology. DSHS will continue to post the number of additional fatalities reported each day. Fatalities are reported based on where the person lived. That's the end of the media release that they put out. So, the difference in the number of COVID-19 deaths reported by the health department and those numbers which are reflected on the state's websites are attributed to the 10 days allowed to file a death certificate. The health district will continue to report daily deaths as we have always reported for communicable diseases in these types of pandemics. The health district conducted our daily drive-through this morning, and we signed up 150 people to go through. 58 came. We had 21 positives from those 58 individuals. That gives us a 36% positive rate for our drive-through. The state continues to test this week at the Richard Borcher Fairgrounds in Robstown from 9 a.m. to 4 p.m. Continue to social distance from others, wear a mask when out in public, stay home if at all possible, stay well, stay protected, and as always, stay informed. Thank you.
Quiere extender sus condolencias a las familias de nuestras 6 muertes relacionadas al COVID-19. La pérdida continua de vidas es muy preocupante y desgarradora para todos nosotros. El Departamento de Servicios de Salud del Estado de Texas emitió un comunicado de prensa el cual explica el cambio en los reportes por fallecimientos vinculados al COVID-19 y explica que está mejorando la notificación de muertes por COVID-19 al identificarlas a través de la causa de muerte que figura en los certificados de defunción. Este método permite que las muertes se cuenten más rápido con datos demográficos más completos. El uso de certificados de defunción también garantiza informes constantes en todo el estado y permite que el departamento muestre las muertes por fecha de fallecimiento, proporcionando al público más información sobre cuándo ocurrieron las muertes. El cambio se va a ver reflejado el 27 de julio del 2020 y se publicará en línea. Una fatalidad se cuenta como causa del COVID-19 cuando el certificador médico determina que el COVID-19 causó directamente la muerte. Este método no incluye la muerte de personas que tuvieron COVID-19, pero murieron por una causa no relacionada. La ley exige que los certificados de defunción se presenten dentro de 10 días. El Departamento de Servicios de Salud del Estado contaba previamente las muertes del COVID-19, ya que fueron informadas públicamente por los departamentos de salud locales y regionales después de recibir una notificación y verificar la muerte. El Departamento Estatal continuará publicando la cantidad de muertes adicionales reportadas cada día. Las muertes se informan según el lugar donde vive la persona. Ese fue el comunicado. El Departamento de Salud local llevó a cabo hoy la toma de especímenes esta mañana y registramos 150 personas. 58 de esas se presentaron y 21 fueron positivas, haciendo un total del 36%.
Good afternoon, Barbara Canales, Nueces County Judge. Well, this is my 3rd press conference today. That makes for an unusual day, but it is a day full of information. And I believe information is vital. And I also believe it's the way that you can commit as an elected official to transparency. So it's been a good day here for transparency and for information in Nueces County. As Mayor McComb indicated, we had the opportunity to meet with Governor Abbott, Chief Nim Kidd, and FEMA Regional Director Tony Robinson today. We were accompanied by our legislative delegation representatives, State Senator Juan Chuy Hinojosa, as well as Chairman Todd Hunter. I'm very happy to report that we all had an opportunity to visit with the governor, give him status updates as to the damage that occurred as a result of Hurricane Hannah, And we believe that that opportunity is precious because it gives us a chance to articulate to him what our needs are, how we see the assessment of damage being undertaken, and also we get to relay with him some of the resources that we're going to need from the state and from our federal partners. I expressed to the governor on behalf of Nueces County that we have been already in close contact and working diligently since Monday morning with the General Land Office. I recently spoke with them before this press briefing, and they've indicated to me that they will trigger their pre-position contracts for beach debris cleanup, both marine and on the beach itself. I informed them that from the county's perspective, we're going to focus on getting the pier itself analyzed structurally. Today was the first part of that analysis where we, through the partnership of Texas A&M and Lone Star Unmanned Aircraft Systems, we were able to fly a drone, a very special drone that has the ability to basically have avoidance detection. So that means you can fly it underneath that pier and get really important data and information. In addition, I think that it was important that the governor hear from all the electeds a little bit about how we're faring with our COVID-19 response here. And I thought it was very intriguing that the governor really spent an equal amount of time on Hurricane Hannah and our recovery as he did with COVID-19 and our current response. He asked thoughtful, critical questions about our testing, about our supplies, about our medical personnel. He wanted to make sure that that we knew that the state of Texas believed wholeheartedly that masks do seem to be working. He shared with us some of the stabilization that has occurred in some of our larger urban centers and was interested in our own data. He also discussed how important it was to continue the fight. He stressed vigorously that we need to stay very diligent on mask wearing and on limiting our reunions and really just overall focusing on trying to reduce the transmission of this virus. It was I thought, very telling how impactful it was to him that people be able to stay in their jobs, to feed their families. He really emphasized how important it was for children to be able to go to school, but to do so in a way that promoted health and safety for families, for children, for staff, for teachers. I thought in all, it was an excellent meeting. We had the opportunity to speak privately before we had the press briefing, and I thought it showed really an excellent example of what governing is all about. Governance and governing is about working together. And I thought that today was a shining example of what Nueces County truly represents. And that is, I'm elected not for some of the people or one particular party. I'm elected to serve all of the people, as is our governor. And today I think we both shared that commitment to making certain that those affected areas, no matter where they be, whether they're in the rural areas or on the coastline or inner city, that all of us, city, county, and even neighboring counties, working together with our state and federal partners, will rebuild as soon as possible. I would also like to close my remarks today by issuing my deepest condolences to all of the family at HCA and Doctors Regional and Bay Area. Losing just a valued member of our healthcare community is especially painful. And as we said to the governor, today I get to say to you that Hurricane Hannah, we fared well because there was no loss of life. But I cannot say the same for Hurricane COVID-19. While we were experiencing Hurricane Hannah, as I said over the course of the weekend, we lost 16 lives. And we keep losing lives. So we're not going to win this battle until we see the fatalities disappear. I also want to express condolences to my friend and colleague, Judge Rudy Madrid. On behalf of Nueces County, we are equally in pain over the loss of your county commissioner, also to COVID-19 today. One of the best parts of being a county judge is knowing that you're part of a group, a very special group of the 254. That 254 represents county judges from 254 counties, and all of us serve as emergency managers on top of all of our other duties. So when Judge Rudy Madrid called me late on Saturday night and he asked how we were faring, and I gave him the report about Bob Hall Pier, and then knowing full well the storm was headed his way, I said, "How are you doing?" And he said, "I've got your back and I know you've got mine." So please, Judge Madrid, the people of Clayburgh County, we mourn today the loss of a great public servant, and we are so sorry that this virus has taken one of your own. I, of course, am happy to answer questions. We've been doing that all day, and I look forward to bringing you more news of recovery along with more news of our COVID-19 response tomorrow. Thank you.
De suma importancia. En lo que evaluamos los daños y necesitamos de recursos, vamos a contar con el apoyo de la Oficina General de Tierras del Estado y contamos con la participación de la Universidad Texas A&M y sus drones. También pudimos discutir nuestra respuesta en cuanto al COVID. El gobernador nos da todo su apoyo y creemos que el uso de cubrebocas ha ayudado mucho, por lo que debemos de continuar con esa práctica, así como con el distanciamiento social. Él sabe también de la importancia de los niños y su regreso a clases, pero hay que hacerlo de una manera segura. El gobernador y yo seguimos con nuestro compromiso de trabajar para usted, no importa en dónde viva o de qué partido político sea. Quiero dar mis más sentido pésame a la comunidad médica por la recién pérdida, y aunque no hubo pérdidas humanas por Hanna, las pérdidas por el virus continúan. El condado de Clayburgh también ha sufrido una pérdida reciente. Una vez que hablé con el juez Madrid, sé que contamos con su ayuda, así como él cuenta con la nuestra.
Okay, that concludes our comments for today. So as we normally do, we want to see if there's any questions that the media might have. Okay, there's nothing today. Okay, very good. Thank you for covering it today live from Chris 6. And we'll be back tomorrow at 5 o'clock then. Everybody stay safe and follow those COVID-19 protocols that we've been talking to you about for about 5 months. Thank you.